Hi, I'm Dr. Wagner, and this is Meredith. We're with Northwest Chiropractic and Rehab, and today we're going to talk about something that I hear an incredible lot about, is shoulder injuries. Shoulder injuries are very much one of the easier things to prevent. The thing about you need to understand with shoulder injuries is first how the shoulder works. Okay, the shoulder is made up of three major components here. We've got the clavicle, the head of the humerus or the upper arm, and then finally we have the scapula, which is the hugest and probably most important part of that. Okay, a lot of people have a misunderstanding of how exactly shoulder injuries occur. You know, they hear from their doctors, their trainers, among other people, that whenever there's a shoulder impingement where they can't go, they put their shoulder in a position, they immediately think, oh, it's a rotator cuff, impingement of sorts. And that's not necessarily the case. Okay, because what happens here with the shoulder, as I said, the scapula makes a huge part of this. Is the scapula is designed in such a way that it will allow a nice smooth gliding motion all throughout the upper back here. And what will happen is it will get stuck in this awkward or funky position here due to some derangement of the muscles, and it will start to catch. Okay, and what will happen is these muscles will disengage. Those are your external rotator cuff muscles. They will disengage, and what will happen is they'll get stretched out. They'll get flimsy, and in a lot of cases, they'll end up causing damage. Now, many people, especially younger folks, don't even realize that they have done any type of damage or have some type of damage going on with their shoulders. Because, when we're young, we don't experience those kind of different things. So one of the first things that I look with patients is I look at their posture. Posture is somewhat the window to your nervous system. Any abnormal postures can show those damages to areas that you might not be aware of. Okay, so when we look at a patient from the side, one of the first things we're looking at with rotator cuff type issues or shoulder issues that we're looking at is the presentation of the shoulders. Okay, you're going to start to notice that the shoulders become more rounded and and more protrusive forward. Okay, the other thing that we're looking at, in a true anatomical position, we should be able to sit in a comfortable position with our hands located out. And as you can see, before she corrected herself, what she was doing was those arms were rotated inwards. Okay, because what happens is when the shoulder gets rotated in an awkward position, it forces the head of the humerus to start to round forward and roll forward in this awkward position. So rather than sitting deep back in the socket of the shoulder there, it causes it to be in an unstable position. Okay, so we start to see a pair of these muscles in the chest area, the pec minor subclavius muscles, start to really bound up and basically hold that the head of the humerus there into position. So what we're going to see is we're going to start to notice a decreased in efficiency or ability to go through certain motions, particularly when the spine goes into extension, and then we have the arm actually go into internal rotation. We see this in our everyday lives a lot more common than you think. In the world of sports, baseball, they go to that extension and wind up, and they turn that arm over for the pitch. Same thing can be said for volleyball. When they're going up to spike the ball, they turn that shoulder into internal rotation. That's the exact same motion that we're seeing with tennis players. And even when we're just putting something like a box up overhead, okay, we're still bringing those shoulders and turning those into internal rotation as the spine's going into extension. So as we lose this scapular mobility, our shoulders and our posture go into this natural, or I really shouldn't say natural, but this defaulted position of internal rotation. It's a very inefficient for the function of the shoulder there. It predisposes you to injury, shuts down the rotator cuff, and to the point where we have this catastrophic injury that requires surgery. So what we're going to do is we're going to talk about some different things that you can do at home in order to prevent these kind of problems from happening. So the first thing we're going to do is we're going to work on this pec minor. Okay, so the best way to do this one is to take this lacrosse ball. It's a very dense, hard ball that's going to allow us to apply some pressure. Because what happens is these ribs in various parts of our body are basically not being freed up. And this is going to allow us to attack that first rib as well as that clavicle from the anterior component. So Meredith, you come right over here. We're going to get started. Okay, so a lot of times with shoulder problems, we lose that internal rotation of the scapula itself. And so what we're going to do is we're going to back that up by gaining that external rotation that has been lost in the shoulder joint itself. So what we'll do is we're going to take that ball, if you can kind of show them where we're going with that, we're going to find that top of that clavicle and place that ball right there. And then you're going to place your shoulder right up against here. What this is going to allow you to do is really free up that motion. So you're just going to basically be bringing your shoulder into various different parts. Sometimes you might have to hold that in place. Just various different motions and kind of find one of those sticky motions that you're going through there. And maybe add the external rotation there to kind of allow that to free up. Now I usually recommend doing about 30 to 40 passes because that'll get you roughly about a minute to 2 minutes in terms of in duration. Work these on both shoulders and do this one about twice a day. Okay. Now what we're going to do is we're going to attack that first rib from the posterior aspect. Okay. So let's have you come lay flat on your back for me, Meredith. Okay. So if you would go ahead and sit up first, that way everyone can see kind of where we're going with this. Okay. So right here is the superior border of the scapula, and just above that is going to be that first rib. And a lot of times when we lose that shoulder range of motion, it's because these ribs are not functioning properly. When those ribs aren't functioning properly, the soft tissue that supports both the scapula itself as well as the shoulder become inhibited. So there's not going to be really in any one area that you're going to place this ball. So what we're going to do is we're going to just kind of feel around and find out where some areas are stickier than others and just are downright uncomfortable. Okay, so go ahead and lay down for me, Meredith. I'll get out of your way so you can see. There we go. And so she's just going to kind of roll that ball around, and she can slide around on it as well, finding that one particular area. Now the next thing that we're going to do is we're going to go through some different ranges of motion so she can start freeing up that shoulder joint. Okay, so Meredith, what you're going to do is you're going to take your hand and touch the opposite hip. Okay, and then the next thing we're going to do is we're going to bring it straight up overhead. Okay, she's already defaulting into a common compensation because what's happening is her shoulder is trying to gain that function, but it's compensating in such a way that's causing that internal rotation. So when we bring this arm up, we want to keep this arm as straight as you can. Okay, right about there is about where she's limited, and this is pretty typical. So we're just going to kind of oscillate right through there and gain some of that back, and then we're going to go back and go through this. Okay, just continue to repeat that. We want to keep that arm just as close to the side of the head as we can, as well as keeping that arm straight so we can gain that. Okay, again, we want to hang out in this position for about 1 to 2 minutes on each side, and we'll continue to work down the medial aspect of the scapula. So if you want to go ahead and sit up, we'll go ahead and target a different area. So we're going to be working down right through here. This is going to help us attack those rhomboids as well as the subscapularis muscles. Okay, so we're just going to kind of work right down through here, and she's just going to slide up and down until she finds one of those stickier areas. I usually recommend, if you have the time, to spend about 15 to 20 seconds on each segment of those ribs. Because the ball is going to be about the size of about 3 segments. So you can easily go down there and attack those sticky ribs. But when you find one that's particularly tender or not moving as well, spend a little bit more time with those. Generally, like I said, I try to spend about 1 minute to 2 minutes on those trickier areas. So go ahead and lay back. Okay. And really what you're trying to do is you're trying to push that ball deep into that part of the sole you didn't know that you really had. And so you may be making some pain faces. Try to fight that. Okay, so we're gonna have 2 options with this part. Because as we start getting to that lower portion of the scapula, this is really going to start affecting those lower ribs. So again, we have two options. We can either continue to do that same motion that we just went through, bottom of the opposite hip all the way up, or to help us regain some of that external rotation. What we're going to do is we're going to place that hand behind the lower back here. Okay. And then what she can do is she can use her own body weight to kind of guide herself up, so you can bend your legs. That way you can kind of rock and roll yourself up and down the inferior or the medial border of the scapula. Okay, so we've hit 3 areas so far. We've hit the first rib from the front as well from the back. Then we went down the medial aspect of those ribs to kind of get those ribs moving so we can reorganize that scapula. The next thing we're going to do is we're going to target some of these external rotators. That's where a lot of the rotator cuff muscles are hanging out. So we're going to target there next. This is my personal favorite to really help loosen up that shoulder, because it really helps us get that external rotation of the shoulder joint back. Okay, so again, we're not really targeting any one particular area, but if you look at any of your anatomy textbooks, a lot of these muscles of the external rotators are going to hang out right through here. So what we're going to do is we're going to place that ball right into this area. So if you can kind of imagine, it's right above where the armpit is. So if you'll just go ahead and lay on back. Okay, we're going to bring the shoulder up through here, and we're just going to guide it through some external rotation right through here. Okay, now you can see right about there is about naturally how far her arm's going, because if she starts to force this anymore, her shoulder is basically coming up and it's going into that internal rotation position. So if you have somebody who can help you, just kind of guide that there, or if you can, take like a bag of weighted rice or something like that, that will help keep that shoulder in that position there. So what we're going to do is we're going to go right through here, and we're going to go through just those normal ranges of motion right through there, which is really going to help us with that external rotation, where a lot of us are losing that, which is causing that rounded shoulder appearance. Okay. Again, we're going to hang out here for somewhere between 1 and 2 minutes. And generally, I try to do this exercise at least twice a day, particularly when you're doing any type of activity, whether it be sports, playing with the kids, or otherwise. So keep mobilizing your shoulders, keeping those joints healthy, and preventing those injuries. And what we'll do is next time we'll go over a different set of exercises to help you continue to prevent your health from being injured and staying healthy. Thank you, and we'll see you next time.